time apparently. Okay, back to VEP prep, and feel free to use all the angles that I was using. You can come in there and use your to get close-ups. And I am now in the patient and director role while we have the...
And don't be afraid to really press because you're not going to hurt him.
Yeah, you can't hurt me. I've got very thick skin, believe me. A lot of women have tried, but...
Did you want that on tape?
It is on tape, right? Okay. It's not really taped though.
All right, let me pull up your chart. Oh, let me check. No, let
So
me
you
check
want to
this.
chin up nice and level.
Here.
Chin up before you measure.
It's here.
This is live, right? We're live on
It's
camera.
live.
Yes, yes, we are
Here.
live.
Show that flat spot on the back of my head where my mom dropped me.
Okay.
Yeah.
So one more time. It's
She thought I was
here.
retarded after that.
And
Chin up.
Chin up?
Yep.
Seriously? Okay.
Not all the way up. Nice and level. Look straight ahead at the
nice
computer
and
monitor.
Straight ahead. Yeah, you are good now.
Will this interfere with my styling gel?
Maybe a little. We can leave the conductive paste in there if you want to make up for it.
I could start branding my own conductive paste.
With smell.
Conditions while it
So,
conducts.
So you see how this is still wet? We want to make sure that we really get in there and scrub, because if that's wet, our sticker's not going to stick. And then I'll also show you a trick for people who have long hair. So you can see, chin up nice and level for me. So you can see, like, his hair's kind of fluffy, so whenever we walk away, we're going to lose our
Don't
spot.
get too many close-ups on the
So-
hair, please.
So if you take a little bit of this conductive paste and put it on your finger, and we measure out exactly chin up, nice and level, where we're supposed to go, nice and midline with his spine. We're going to be about right here. You can go ahead and mark this off.
We can
That way you
mark
don't
for
lose
us.
it.
Yeah, you're right. Thank you. Very nice too. Now we can take.
So you don't wear any type of correction?
Me?
Yep.
I have contact lenses.
Okay. And they're single vision.
RGP. Oh no.
They're not single vision?
No, I have a fancy multifocal in the right.
Okay, well that's going to mess with our test results.
Ooh.
So just
I
keep
see
in
that.
mind, she's going to do it for practice anyway. You want to
Okay.
make sure that she gets the hands on.
Okay.
But you don't want to base anything off of the test results that we're going to get for that right eye.
Okay.
Because it's multifocal, it's going to mess with our test results. So come in like one morning without them in, put on a pair of glasses and let them test you to get a true
Single
reading
vision
on you.
glasses.
Right.
Okay, I do have glasses.
If
See?
you want to get like a true reading.
Okay.
Up
but
to date.
Today we'll do it this way, and then we'll do it another day with the glasses, obviously. Yes.
Do you know your correction?
It should be in my chart. You guys have access to the Athena?
Is there a button?
No computer in here? I thought they were running a computer in here.
We need one, but we don't have one.
Let's get one. Could use one of those down there.
Yeah, I think we need a monitor though. And does Mia
Put it on
use
my
this?
list.
Okay,
Yeah,
doctor.
once in a while.
Look straight ahead.
Looks.
So you want to make sure that you
Yeah.
get as much hair out of the way as possible
Yes.
because we want to be as close to on his scalp as possible.
Yeah.
You're going to put this exactly, don't move that because that's where we're going to go.
Exactly, yeah.
Yep, and then all 5 fingers around, we want to press here, we don't want to press on that button.
Oh, okay.
So it should actually be more of a cone shape than completely flat.
Okay.
So you see how it kind of presses out?
Mm-hmm.
Okay. So we just want to make sure that we wiggle it in just a little bit more. If we lift it and the hair comes with it, we know that we don't have a really good connection. That's what we want. Okay.
Now, go and put the black one in the middle.
Now we're going to come over around this side. And be very careful, don't pull on this because it'll pull this off.
In the middle.
You reorganizing over there, Carly?
I mean, does this laptop work? I was going to say that.
Yeah, I think it does.
We can use this for a monitor and use the computer as the.
Yeah. Hey, it's enough to give you the data on the chart, right?
Yeah.
And that way you don't have to go back and forth to the other room.
Okay. We put here a little press.
All 5 fingers
Very
around.
good. And now And then one more.
We'll
on
just
the
make
back.
sure that we go underneath
Yeah,
it.
yes.
There we go.
One.
It's amazing that a multifocal would
Yeah.
have that impact.
I used to have with me, and I don't have it anymore because I got rid of that flash drive. I think I accidentally deleted it. I used to have, there was a patient that we tested one time in one of the practices that I was in, and her test results were terrible. Like, amplitude was low, latencies were late, everything was red, and the doctor was like, oh my gosh, we need to like start treating this patient. Okay, what we're gonna do, don't pull on it. So what we're gonna do is just get that out of his way, and we're gonna tuck this right behind his ears. But anyway, so the doctor was like, oh my gosh, I need to start testing or treating this patient. Well, whenever they walked out of the room with the patient, I went to put the trial lenses back up, and I realized they didn't have the right correction in the trial lenses.
Oh,
So we had to bring
yeah.
her back in, fix that, and we retested her.
Yeah.
Beautiful results.
So correction makes a
It
huge
makes a
difference.
huge
But I
difference.
was able to see the pattern quite clearly.
Right, but whenever we're, there's the ruler. Are you looking for the ruler?
Was the ruler.
It's the edges, like I was explaining to them earlier, it's the edges between the
Dr.
checkerboard
Ryan,
patterns
you have
that's
to move little
stimulating.
bit. Okay.
Are you nice and centered with the computer monitor? Do you need to scoot over a little bit?
Open your eyes now. It's time. And
Back a little bit.
little back, little back. No, the chair. Yeah, no, little close. Little more close. Okay, good now.
And then he needs the occluder, it's right behind you.
Yes, yeah. And first we can reach
And do you remember what to say to him?
right eye. And now, are you okay in your position? Now you can see a red circle. You have to look in a red circle. Do not think about anything. Just relax. Look to the red circle. And we have to. We do one eye per time. Put your occluder on you, like this one. Yes.
Can he blink during the test?
And you can blink, but not a lot. Maybe one time. You can blink now before the test. Yes, are you
Just tell
okay?
them naturally, just not to overdo it.
Naturally, yes. Are
Can
you
you-
okay now?
Can you talk
Eyes a
during the
little
test?
dry.
You
They are dry?
do you have any question
What's
now?
going on, Archie,
Because
too?
you cannot talk during the
Do you
test.
have
huh?
anything? No.
Eye is
Yeah.
dry. Look at it.
What?
My eye is dry.
Dry? Okay, we can bring for you.
I wear
Carla's gonna grab
RGB
us
lenses.
And put for okay. We can put
And then,
Let's see what we're doing.
during the test. You
String in
don't
my
allow
bag.
to talk,
oh yeah,
please.
thank you.
If not, I'm gonna have some messages.
Smoothing that dialogue out a little bit,
Please.
okay? We need to
Yeah.
work on that.
And
We
you
need to
guys,
get a nice smooth
I
dialogue where
recognize.
if you
know
look
where
over
your
here on your
stuff
cheat
is.
sheet, it will actually tell you to tell the patient, watch the screen as if you're watching TV. Look at the center of the screen, relax and focus on the changing pattern. You may blink as needed, please no talking. The only thing this doesn't do that I do is address the red target. Because if you don't say anything about it, your little ladies, especially whenever you start the test, are going to be like, well, there's the red circle. Am I supposed to look at that, or what am I supposed to look at?
Mm-hmm.
So you can always tell them, watch the screen as if you're watching TV, look at the center of the screen toward the little red target.
Yeah, I've had people ask that for sure. Like,
Yeah.
what am I looking at?
Right, exactly. And you want to keep it nice and simple because the
So
more,
much better.
you know, the more you get into detail about it, the more confused they're going to get. If you tell them, look at the little circle, but don't look only at that, look around. You don't want them doing all that stuff. So just
Okay,
keep it
are you
simple.
ready now?
Yes,
This is
you
your,
want to stop and then restart?
this is your